My name is Lauren O'Shea and I'm the Regional Placement Facilitator in the discipline of Occupational Therapy. In this short PowerPoint presentation, I'm going to give a quick overview of the learning contract documentation and resources that are specific to the Trinity College Dublin Occupational Therapy Practice Education System. So on our Practice Education website, we have a PDF which outlines the learning contract guidelines. It includes a definition of what a learning contract is, the benefits of having a learning contract, the key characteristics of a learning contract, for example, it being collaborative, it being negotiable, etc. And the steps advised in creating and maintaining a learning contract, and some nice examples across years 1 to 4. This is an overview of the learning contract template, which is available on the Practice Education website. So as you can see, there's 5 sections. The first being the learning need. So what I need to learn more about. It can be knowledge, skills, or a specific competency area. The specific learning objective then, identifying a specific area to work on to meet your learning need identified. The learning activity or activities required. So outline of what you will do in order to achieve the learning objective, and you're to include evidence to demonstrate how you will achieve this objective. The competency area and number, so list competency number from the assessment form, and then the timescale when you intend to have completed this piece of learning. So then the practice educator and the student will sign off on the learning contract. Just some examples, just going to share 2 brief examples with you here. So in this case, the learning need is to demonstrate effective time management. The learning objective specifically is I will independently plan and prioritize my caseload using my diary and communicate my plan to my practice educator each morning by week 6. The learning activities involved then are utilising resources, so example diary, to schedule time for clinical and non-clinical tasks with support from my practice educator. Take time each morning to prioritise my workload and plan my clinical and non-clinical time. Discuss strategies used with practice educators, such as setting times for myself to complete certain tasks. Reflecting on my documentation, in particularly applying clinical reasoning in my analysis to make me more efficient in documenting. This relates to a number of competencies as per the competency assessment form, and then the weeks and the timescales in which each of those learning activities are to be completed are identified there: week 2, 3, week 4 and 5. Another nice example here, in this case, the learning need is to demonstrate effective communication. The specific learning objective is I will feedback at the weekly multidisciplinary team meeting on 3 cases with supervision from my practice educator. So very specific, definitely following those guidelines. The learning activities which are to be included are preparation for practice education modules on reflection and use of clinical observation aid, complete clinical observation aid following weekly MDT, reflect on strengths and weaknesses as a communicator, familiarise myself with documentation and professional language through review of clinical notes, feedback one-to-one to other disciplines with supervision from practice educator, and then reflect on same to maximise my learning. Write out feedback in advance of multidisciplinary teams, so to be prepared, feedback on one patient in MDT independently, and to build this up. Okay, that relates to a number of competencies across the competency assessment form, and then the weeks in which this will be achieved are very clearly outlined in the last column there. TCD, OT, practice education documentation and resources to support learning contract creation and maintenance. So you have your assessment form, which clearly outlines the 5 competency areas, which are broken down in greater detail. The timelines and expectations document, 1 per year. The supervision forms, so the pre-supervision forms and the weekly supervision forms, recorded reflections, from the student. Training resources, then there's a piece relating to learning objective and learning objective creation in the inter-university intro to practice education training, and also there's one of the OT Practice Education Network webinars focuses on learning objectives. So they're available to both the student and the practice educator. Practical tips then, very useful to take the time to review and prioritise competency areas requiring improvement as a starting point. This will be very based on the year, the clinical setting and opportunities available. So for example, if you're in 3rd year and you've had good exposure and experience in the area of communication, professional development, but maybe you've had less exposure in the areas of occupation and OT process, maybe your learning contract and your learning objectives would be very reflective of that need. So it's important to really take time at the beginning of each placement and to discuss it with your practice educator, which competency areas you've had experience and exposure to, and which competencies maybe have you had less experience and exposure to, and what specific areas within those competencies, and that will help to form the foundation of the learning contract. We're asked this question all the time, but it is an option to do longer term objectives, which are broken down into short term goals. Absolutely an option. Another option is to do short term weekly objectives, which some students find much easier. So it will be very much dependent on your personality type, your learning style, the teaching style of the practice educator, and what fits in terms of the structure of the learning contract. But just remember, it's flexible, it's negotiable, and it will be reviewed on a weekly basis. But it is for you, and it's to support your learning, so it must be done in a format and a manner that will support you. Very important that this learning contract is brought to each supervision session and that it's reviewed in each supervision session to see where you're at with it, and important that the learning contract is added to the CPT portfolio following the placement. Very important to use user supports available to you, so your own peers, your practice educator, the university-based practice education team, and remember that it's a supportive tool that aims to provide structure to the students' learning.